keep his eyes to himself.
Eyes down.
Now.
Looking at him.
Eyes down. Losing his
Looking
money.
down. He paid
They're
already.
looking at you.
He should keep his eyes to himself.
What's happening?
They're all looking at him. Yes, they are. They're all looking
Something
at
in the way. He's clumsy. Time you left. Hide away. Hide. Snap out of it.
Schizophrenia is among the rarest mental disorders with an incident rate of 8 out of 1,000 people per year. Schizophrenia varies among race, location, and gender. Though uncommon, it is both chronic and severe. The video that we included at the beginning of this presentation does a good job illustrating some of the difficulties that patients with schizophrenia face. The disorder is defined by 5 different domains of abnormality: delusions, hallucinations, disorganized thinking, disorganized and abnormal motor behavior, including catatonia, and negative symptoms. Here with me right now, we have Jennifer Hernandez, who's going to go into more of the symptoms of schizophrenia.
Yeah, so starting with delusions. Delusions are fixed beliefs that have no basis in reality. If you try to present a person with schizophrenia with contradictory facts, these delusions, these beliefs, will remain unwavering regardless of what you present them with. Next, we have hallucinations. Hallucinations are perceptions that occur without an external source. And to the person with schizophrenia, these perceptions are just as real as any other real perceptions that they might have or any perceptions that we might have. And they're just as vivid as well. These perceptions can be sensory or visual, but the most common hallucination is an auditory hallucination, so such as the video we saw where they were hearing things, hearing voices. Disorganized thinking is the next symptom, and that's oftentimes assessed by the person's speech patterns. So they might frequently switch topics and answer questions with vaguely related or completely unrelated answers. Next, we have disorganized and abnormal motor behavior. So this can range from childlike, silly behavior, such as bowling at nothing or wearing 3 different hats at once, to unpredictable agitation, which can be anger or frustration or yelling. Catatonic behavior involves a lack of reactivity to the environment. In extreme cases, this can be shown as mutism, so not speaking, or stupor, as not moving. All of these symptoms that I've mentioned thus far are considered positive symptoms because they're symptoms that patients with schizophrenia show that people who do not have the disorder do not show. But now let's talk about negative symptoms. So negative symptoms are characteristics that people with schizophrenia do not show that others without the disorder do show. So these symptoms include lack of motivation, disinterest in social activity, inability to experience pleasure or happiness. Other symptoms that can support a diagnosis include negative affect, such as depressive moods, inappropriate affect, such as laughing without an appropriate stimulus, disturbed sleep patterns, or a lack of interest in eating.
So now that she's gone through all the symptoms, can you please elaborate on the diagnostic criteria of schizophrenia?
Right. So for an individual to actually be diagnosed with schizophrenia, they must exhibit 2 out of the 5 symptoms that I had just previously mentioned. Within a 1-month period, it must be significant exhibition of these symptoms. And at least one of those symptoms must be either delusions, hallucinations, or disorganized thought. They must show signs of disturbance for at least 6 months, and their functioning must be considered substantially worse than it was before the onset of the disorder.
Okay, thank you. So building off the symptoms, we're going to move into risk factors. With us tonight, we have a general psychologist, Emily Peterson, who deals with cases of schizophrenia all the time. So Emily, what do you see in risk factors of schizophrenia?
So schizophrenia is a highly complex disorder with many different contributory factors. It has an estimated heritability of about 80%, and research has indicated genes located on 6 different chromosomes that can be described as candidate genes. One of those important genes is the COMT gene, which is on chromosome 22. When this gene is deleted, it disrupts the dopamine processes. And when these processes are interrupted, psychosis is often induced. The deregulation of dopamine causes individuals to pay more attention to stimuli that was often in the background before, which contributes to emphasizing hallucinations. Many of the genes have a weak effect on their own, but when they're combined with environmental factors, they're subject to mutations that are contributory to schizophrenia.
Okay, so you mentioned environmental factors. Can you name some of these?
Yes, so some of the environmental factors that cause development of schizophrenia include living in an urban environment at a young age, being a first or second generation immigrant, and early use of cannabis, because they can all cause stress on the mind and body.
So building off that, Emily, when does schizophrenia typically develop?
So the beginnings of schizophrenia are formed very early on in life, because the majority of neuronal migration occurs in the second trimester of pregnancy. Many infants whose mothers came in contact with autoimmune disorders or infections their infants were much more at risk for developing the schizophrenia later on in life. And although they are developing these factors at a very early age, symptomology doesn't typically start showing until they're about 18 or 19 years old.
So now that we've talked about the symptomology of schizophrenia, we're going to shift gears and talk about treatment. To my left, we have our treatment expert, Melanie Griggs. So are there any effective treatments for schizophrenia today?
So unfortunately, there is really no most effective treatment. It's mostly based on the individual patient's needs. Pharmacotherapy is the standard treatment for patients with schizophrenia, and so far 64 antipsychotic drugs have been developed that all target the D2 dopamine receptors in the brain, and they aim to reduce the patient's positive and negative symptoms. Depending on the client's other possible symptoms, tranquilizers and other antidepressants may also be administered in addition to the antipsychotics.
Okay. Do you have any examples of the types of drugs used in these treatments?
Yes, so some of the most common ones used are haloperidol, which is one of the first drugs developed. In addition, there's also amisulpride and olanzapine.
Do these come with any negative side effects at all?
Yes, all of the 64 drugs come with a plethora of side effects, ranging from weight gain and sedation to obsessive compulsive symptoms.
In our research, we've come across that psychosocial therapy has been a big part of treatment in schizophrenia. Are you willing to elaborate on that?
Yes, so psychosocial therapies are available and are typically used in tandem with pharmacotherapy. The psychosocial therapies address patients' symptoms, but mostly work to improve patients' social and vocational skills. Cognitive behavioral therapy, or CBT, is also an option and focuses on challenging the patient's distorted beliefs. Other therapies, such as cognitive remediation, assertive community treatment, or ACT, and social skills training, or SST, work to improve the patient's functioning in self-care, as well as social and occupational situations.
So now that we've talked about the two types of treatments for schizophrenia, what do the outcomes look like for these?
So many of the psychosocial therapies have inconsistent or only moderate efficacy rates. Certain therapies have proven to be more effective for certain patients, but overall the results are mixed. For example, CBT and amisulpride have been found to be more effective therapies for patients with paranoia. Family therapy and psychoeducation have been shown to help prevent relapse rates and hospitalization. Overall, utilizing multiple psychosocial therapies as well as multiple antipsychotics can improve efficacy rates, but many advancements are still needed.
Thank you. Okay, we have Emily Peterson back with us tonight to share some final thoughts on schizophrenia. Emily?
So, although research on schizophrenia has been around for a little over 70 years, still much of the data is very inconclusive. Much more research and experimentation on schizophrenia need to be done to really understand the complexities of the disorder. Hopefully after tonight, you will all have a better grasp on how to identify schizophrenia and a better understanding on the treatments and who's at risk of development.
So that's all for us tonight. Thanks for watching.